about now.
Okay, yeah, perfect. I have that here also. Good, okay. So I saw your questions, so fire away. What do you want to know?
All right. Just to start with an introduction. Hello, everyone. My name is Omar Remaly. I'm a first-year medical student at RCSI Bahrain, and I've just had the absolute pleasure of interviewing you, a distinguished professor and highly respected researcher. And just so everyone else who's listening to this, joining us is Professor Werner Bischoff, whose contributions to microbiology have significantly advanced our understanding of a multitude of infectious pathogens, including MRSA, VRE, several strains of influenza, and the global pandemic-inducing SARS-CoV-2, naming him a hero of microbiology. Welcome, Professor, and thank you for taking the time to share your insights with us.
Thank you for having me. Yep.
Yeah. So in preparing for our conversation, we were talking about this previously. I found like hundreds upon thousands of articles, but I couldn't help but find that there was a lack of anything about your own personal narrative. So I'm just taking the opportunity today to find out about a lot more about the person behind the research, if you don't mind. So just firstly, in terms of questions, just start us off with where you were born.
Yeah, okay, good. So I was born actually in Germany, in the western part of Germany, that was still kind of divided at that point in time. So, yeah, I grew up actually in Germany, went to school there, then went through military service, and then I went through medical school in Germany, actually, at the Georg August University in Göttingen. I got my kind of degree there in Germany in medicine. Also did my doctoral thesis here in Germany. That's one of the kind of special, or that's a difference to I think the American system and quite a few others, that we actually, if you want to have a doctorate, you have to actually write a thesis, do a research project, and that actually kind of brought me into research, contact with research and doing research. And so since then, I'm kind of have been kind of tilted more in the direction of research, so yeah, that's kind of where I grew up and how I came into medicine. Yeah.
Yeah. So talking a bit more, because you talked about how your own personal experiences in Germany have led to you pursuing a career in research. Do you have any personal or childhood experiences that have led you specifically into infectious disease or research in general, that you were like, this is what I want to do?
Yeah, I
Perhaps?
think it's kind of it's I think interesting. It definitely, I wasn't kind of the 6-year-old that said I wanted to be a great researcher and I want to go into medicine or whatever. No, not at all. I didn't know what to do, even when I kind of finished my school and I was looking around and saying, okay, what kind of career do I want to take? So medicine was one of these things that I just fell into during my military service. That was at that point in Germany statutory that you have to do that. And I was actually kind of part of the medics there in Germany. And so I was actually kind of trained there as a medic and had first contact with the hospital and hospital settings. And I really liked it. And I said, you know what, maybe if I have nothing better to do, just apply to medical school. And so I got in, and so the rest is pretty much history. But there was nothing kind of really kind of said, oh my goodness, I have that a great experience or something like that hit me. Research, then going into research, again, explained a little bit with the doctoral thesis that we have to complete in Germany. And I was lucky to actually start off with a research project that went not well at all. I spent over a year on it and it didn't go anywhere. And so then kind of being kind of tossed to somebody else, another mentor, who kind of pretty much said, you know what, look, I think we can do something and together. And so I've worked with him and had a great experience. Actually, kind of that research can be actually kind of really successful and you can have a lot of fun with it. And so that got me kind of into that track of doing research. Patient care, yes, I did that in Germany. And I think it's really, it's great. It's very satisfying. But early on, I realized, you know what, maybe that's not kind of where I want to be. And so the research track was pretty much kind of then open for me, and I pursued that.
Yeah, that is so great because you touched on so many points. And actually, one of the things that you said about spending a year on research and then it not ending up anywhere, especially during this challenge or any other challenges that you might have faced in your life. What do you think got you out of it, or what do you think motivated you to kind of like still continue? Because I think a year of research and then it not ending up anywhere for a lot of people, that would be devastating, would it
No,
not
never
be?
again. Yeah, yeah.
Yeah.
No, I can't. I'm probably, that's a personality trait, is probably being stubborn and saying, oh, wait a second, yeah, and one can do better. And I think that is what I learned. I went into research. I had no idea. And I think there was kind of that thing that I was trusting very much kind of what my mentor at that point told me and how to do that. And then really in the midst of it, I didn't have time to really reflect on it. So yeah, it took quite a few months, a lot of effort. And then at the end, it was kind of, okay, look, it doesn't go anywhere. And talking to then kind of, especially statisticians that looked at my work, the data that I collected, and they told me, you know what, no, you cannot do anything with that. And you should have come to me, to me earlier. That was kind of his wording. And well, that didn't help me, but it also didn't discourage me, because I say, you know what, look, I can do better. And I found a different mentor that was really supportive of me and of my career. And he also helped me kind of progressing in it. And so that kind of really rescued me for research. But I think that's the thing for a bunch of times in my life, that if you feel, you know what, you're in a dead end or something like that, never underestimate. There are always kind of doors opening for you. There are opportunities that are coming up. Never ever give up on saying, oh well, oh, that's kind of never. And stay in a miserable situation. That's not kind of what you should do. You should try and seek out and challenge yourself. I think that's the biggest thing that I can tell you. If you're at the beginning of your career, and I think you just mentioned first year medical student, challenge yourself. And the things that you really think, oh my goodness, I cannot do that, these are probably the most rewarding experiences that you will have if you jump in. Yeah, so that's my recommendation.
Truly words that I'd probably live by for the rest of my life, honestly. Because honestly, had I been in that same situation, I would have been like, oh God, like a whole year, and I'm the one being blamed by my supervisor. That must have been horrible.
Yeah, but
yeah.
It's all about kind of also. I think it's important if you have a support system behind you. Yeah, and my family was very supportive of that, and there was never ever a doubt. Yeah, and of course you can take different paths in your career, but it's my take on it is take something that challenges you, that you're saying, oh, wait a second, that maybe is a little bit out of my comfort zone. But trust me, that will be the stuff that you will think back and say, oh, wow, that's great that I did that. Yeah. Even if you end up in kind of, oh, no, I'm going a different direction. These are the moments where you kind of really define yourself and see, you know what, I can do that. Yeah. So.
Yeah. But in terms of, I just want to ask you a question about research and then we'll continue on about your personal life. Do you think that there's like an equal, that clinical work and research work are valued equally in terms of in academia as well as in like the wider public? Do you think they're both seen as equals, or do you think that there's like a discrepancy by any chance?
I think that's really hard to answer, because I have done research for quite a while, and I have done kind of clinical work, and now I'm kind of more in the administrative role here, over seeing infection prevention in our health system. So it is, I think every area kind of has different benefits and different challenges with it. For research, of course, there is always the idea that, oh, wow, yeah, you're kind of working on something that flies to the moon or something like that, or you will be the first one on Mars, which is fantastic if you set that goal. But it's a lot of tedious work in research. It's a lot of following recipes that somebody else cooked up for you and then kind of trying to improve them. It's you step, as they always say, you're always kind of on the shoulders of another person that you build your research on. There's nothing genuinely, oh, wow, yeah, these are the extreme cases where you have some breakthrough and that gets you the Nobel Prize. So, but I think the vast majority probably will not get that, and I won't get it, so period. But the thing is that you have to put the same effort that you put in clinical work and being diligent, looking at patient records and really making sure that you understand the history of a patient before you come up with a diagnosis. All is kind of also reflected in your work and research. You have to build up, you have to be very detail oriented to get really good results that you can repeat. Yeah. And so I would say it's probably equal what you have kind of in the recognition of it. I think researchers can, of course, get great prizes and all that stuff. They may be a little bit more on the public, but a clinician that works really well, you have the direct patient to provider contact that is so rewarding that once in a while I miss it because I'm not practicing in the United States. So I do not have that. Yeah, this direct contact. So you pay the price for it, but you also have gains on the other end that may be different.
That's something that actually I wasn't expecting that answer, to be honest. But it actually leads on to a point that I've been thinking about and my colleagues while we were talking about this, because most of my colleagues got assigned the classics, Louis Pasteur, for example, and you kind of think, even though like if we compare it to what what microbiologists have accomplished today, like for example during COVID, how how much time or like lack of time that they had to get a whole sequence of SARS-CoV and 2 and whatnot. Do you think that there'll ever be a moment where we get one of those classics or someone that gets that name, or do you think we've reached the level where no, everyone kind of gets like a collective achievement, like an achievement for the greater good?
I think it is spreading out probably more, and I agree. Kind of, if I hear you correctly, I probably agree with your statement. It's more a team that should be recognized, and because it's a team now that works on it, I would even claim that a bunch of the works where we have kind of now a single name associated with it. There are a bunch of technicians behind that. There was a team already behind it. There were assistants behind it, yeah, that are not named. They are just kind of falling into the kind of darkness of history. And you are looking as a principal investigator that is kind of now, of course, the one that is the one responsible for the study and all that stuff. But a PI without a team is nothing. Yeah. So, and that's kind of what my experience is. So I think moving forward, there's probably, I would say, it should be actually more recognized. It's a team effort, and probably prizes should be given to teams more than it is to individuals. They may be brilliant and absolutely great and great leaders of teams and all that stuff, but all the details, all the groundwork that goes into it, and all the discussions that you have with your colleagues inside of a team to get you further in your recognition process and acknowledging the contributions that other people have with it. I think that is something that should be a little bit more on the forefront in research. Yes.
Research. I think we've definitely gotten our theme, because that's something that we were discussing, because we were talking about what's something that we could have done to link all of the people that we got assigned together. And I think one of them definitely would be, because we were discussing that even in the past, because we didn't have regulation in the past, we didn't have legislation that talked about respecting patients that you were collecting samples from and whatnot, and the contributions of the families of, like, you can't have oftentimes these men that were the greats of the greats had a family behind them. They had financial support, and that's not something that's talked about enough. But just for the sake of time, we'll move on to something a bit more personal to
Yes.
you.
No, sure.
And it's a big question that I had, which is why the move from Germany to the States? Because like personally for me, so I'm Egyptian, and my family moved to the UAE, and now I'm at RCSI Bahrain, which is an Irish university, but it is in the Middle East. And like from our perception, Germany is like considered like a research hub, like this is where you want to be, you know. Of course, the States has its prestige and all, but like, why? Why move from Germany to the States, I wonder?
Yeah. So I was working in Germany, and I was working on my specialty, etc., in Germany, and I had the opportunity to take on a scholarship and study kind of infectious diseases, infection prevention in the United States. And so I was lucky to actually get that scholarship. So I came over here, that was in 96, 97, that I spent actually not only a year, but 1.5 years. I got an extension to work on a research project here, to go to Richmond, Virginia, to the Medical College of Virginia, and work there with one of the renowned infection prevention experts, Dr. Wenzel. And so I kind of packed up my suitcase in Germany and flew over with a suitcase and landed here. My English wasn't good, I have to truly admit that. And spent 1.5 years doing research. And during that time, actually, I met my wife. So it was then kind of going back to Germany, finishing my specialty there. And in 2000, we got married in 99, and in 2000 I decided, okay, look, I was working then at a university clinic in Germany, Medical School of Hanover, very nice kind of big university clinic, very interesting in microbiology, and I had a nice position there. Everything was fantastic, and I decided to say, you know what? I just stop everything. My wife is in the United States, she's American, and so I'm moving to America and see and take my chances. And I think that's kind of a theme probably in kind of my life, kind of, okay, just
The
what's the
American
challenge?
dream.
Yeah. Yeah,
Yeah.
exactly. And so I didn't have a job. I didn't have anything. So I moved in 2000, beginning of 2000. I moved to the United States, again with 2 suitcases, and then applied for positions here, research assistant, etc., with the thing that I wanted to get my master's in epidemiology or kind of in research. And so I was then lucky to get hired here at Wake Forest School of Medicine, and got into a master's program. And after the master's program, I decided, you know what, I was working at the same time doing my master's as an instructor here on an NIH grant, and had a great mentor. Again, I was lucky. And so after my master's, I decided, you know what, I don't have enough of that stuff. I want to still go to school. So I went for my PhD at University of North Carolina at Chapel Hill. So I got my PhD there in epidemiology. And I stayed here at Wake Forest, at the School of Medicine, and built up a new life in the United States. I tell you, there was a lot of challenges during the time, but it was also the best decision in my life to do that. But trust me, the 3 months that I didn't have a position here in the United States when I came over, I don't want to repeat that. That was very
Must have been
stressful.
really difficult, but like, come on, now like it was a couple of months, but like now you're living the American dream.
Yeah, so
Uh,
it's
yeah.
just kind of you kind of you pick the challenges that you want to put yourself in there. But there was a point in my life where I say, you know what, look, I have to make the jump, otherwise it's kind of getting. And I finished pretty much all my medical education in Germany, my specialty in Germany, and I couldn't use anything here in the United States. So I had to do something to get back to kind of that academic level that I want to be in.
Yeah. But talking about, because you hinted about getting married, and especially when it comes to, because you mentioned also moving to a more administrative role currently, correct?
Yeah.
Um, so how do you manage that work-life balance? And could you talk a little bit more about your administrative role, if
Yeah.
that would be possible?
So let's start with the admin role that I have here. So I am the medical director over infection prevention and health system epidemiology at the Atrium Health Big Forest Market. Yeah. So we have here one big academic center, and then we have several smaller hospitals that I'm overseeing for infection prevention and all the wonderful things that come with here. We have a team now of kind of 20, 21 folks here working for me. And so we are organizing everything, infection prevention. Of course, we had a fantastic time during COVID-19. So the pandemic was really challenging for all of us. So we got through that. And so that's kind of what I'm kind of doing. And there's a lot of administrative stuff involved in it, but also it is quite challenging with the questions that are coming up, from isolation precautions to communicable diseases, etc. So, and the balance question for family and career, yeah, it's kind of every day. Every day is a challenge, and every day you have to kind of balance kind of the kind of demands that the job has and what the family also has. And I think it is finding there the balance. I think that's so important. And I think that's kind of, I'm lucky. My partner is wonderful, my wife. And so we are also working in the same field. She is a public health epidemiologist. So trust me, our children are completely bored because our dinner conversations are going about smallpox and other stuff.
Yeah.
But it is just kind of the understanding there that you know what, yeah, it's demanding, but it's also I'm lucky enough that I do not have to be on call. I'm actually 24/7 on call because I'm the only medical director here, but that doesn't mean that I'm getting caught up in the middle of the night. Of course, only if we have, let's say, an Ebola patient or something like this coming through the door, yes, then yes. But it is challenging, but it's also very rewarding. And with the family, it's just kind of making sure that you set your times where you are not having your phone with you, where you're kind of just focusing really on your kids, on your wife, and really trying to be the husband, to be the father that they deserve. So that's definitely something. But I think it's getting, at least in Europe, what I see kind of in Germany, etc., and other countries, it's getting a lot better with the protection and also with the equality with paternity leave, etc., and all these things. So I think the United States is a little bit behind that. And
Yeah.
I'm kind of growing out of that age range. So hopefully you will benefit some of that stuff. But it's again, I think the direction is fantastic that more modern societies are taking now.
So especially talking about going over to the professional side, and obviously I'm taking care of the time because I'm so grateful for the opportunity, but I know it's quite scarce. Especially, how would you say that your work has potentially shaped policy? Or what would you say the biggest, like looking back at your career, what's like the defining moment of this is what I've given to the world, pretty much?
I think I don't feel that there's anything that I have kind of said, oh my goodness, that was absolutely groundbreaking, and that now everybody is kind of doing exactly what I recommended them to do. I think that I'm probably not delusional enough for that. I think it is more on the small things that I have done during the last few years with the pandemic. To be here, to show that one can get through it, one can protect the staff here, the providers, the nurses, everybody that has contact with COVID-19 patients, that together we can handle that, and that we are not kind of causing kind of harm to our providers, and also kind of trying to protect our patients, our families, and getting them through it. So I think that is probably the most kind of rewarding aspect of my career. If I'm going into research, I think I had a ton of fun. doing some of the face mask testing and all that stuff, and exposing volunteers to live attenuated influenza virus, and so that was just kind of, I think that was the icing on the cake. Yeah, you cannot kind of mix that up. It's just kind of fun to work with that. What was the outcome? I think there were some lessons learned with respirators compared to surgical masks, etc., that can be transferred and have been used to maybe kind of push a little kind of the kind of guideline development, etc., in the right way. But I'm just one of the folks that have contributed to that, and so I'm not claiming that, oh wow, they're listening now to me. I think that would be not correct to do that. Yeah. So
yeah, just being aware of time. Again, I'm so sorry, because I genuinely, if I had the option, I would stay hours talking to you, honestly, because you seem like you have so much to give, honestly.
hey.
But I guess this will have to be our last question, correct?
Yes.
So as like a seasoned professional, especially looking at the field of microbiology, because everyone's kind of looking at it right now, especially after the pandemic, or just
Yeah.
looking at medical students like me who are at the beginning of their very arduous path. Do you have any like final plasmids of information to share to kind of help us carry on that?
I think medicine is such a broad field. Yeah. You can be a bench researcher that focus on whatever polysaccharide connection between cells, and you can spend the rest of your life studying that. Or you can go into global health and look at vaccine efficacy and how we can maybe kind of get rid of measles and some other contagious diseases, and spend your day kind of and your time in really trying to push that forward. So I think that's a wonderful aspect of medicine, that you have all these choices in front of you. On one hand, is probably wonderful. On the other hand, it's a little bit scary. Yeah, where the heck do I end up? Do I really like then what I'm doing? And I think there is my advice is to be open, and probably kind of, if you have a great idea where you want to go, that's fantastic. Congratulations. I did not have that for a very long time in my career. And but if you have it, fantastic, and follow your dream. That's great. Yeah. But if you are maybe not so decided, try out stuff. Yeah. If it is a little bit of surgery and see if that's fitting. Yeah. If it is microbiology. Yeah. If you are fascinated and the microscope is kind of having the appeal, and that was for me the case. Yeah, that I say, oh, that's cool. Yeah. And microbiology is so much now kind of with automated testing, with PCR and all that stuff, that is absolutely mind-blogging what we can do, what other generation couldn't do. So you can go pharmaceutical. Yeah. So pharmacy, fantastic development of new drugs. Great. Yeah. So test all of that out, and you have the entire clinical field. You can see patients, and you can have the rewards with the connections that you make with them, and that you can see them actually kind of get better. So all of that is in medicine. So be open and look at that, and pick what you want to do, but be open. If there's a challenge, take it on. If it doesn't work, fine. There are so many other opportunities out there. That's kind of my tip. Stay on it, and I hope that you have as much fun and find as much kind of rewards and satisfaction as I have done in my career so far.
Yeah, honestly, because I don't say this, and I don't say this as an exaggeration. I genuinely am kind of frazzled a bit, because it is, yeah, like I am kind of, because you touched on the point of trying to choose a specialty and looking at like 1,000 doors and being scared that if you choose the wrong one, 1,000 are going to close and you're never going to be that way. But I guess trying out multiple things all at the same time and trying to see what works for you is probably like the best strategy. But I just want to say thank you so much for having me. I genuinely sent that LinkedIn message as like a last ditch hope, being like, I hope this man replies. I hope. And just like I'm so like this has genuinely been a once in a lifetime opportunity getting to speak with you, getting to see the person behind the name on the research. And it's just, yeah, because I kind of forget a little bit that the name that you see on the paper is like an actual human being with a life and whatnot. But yeah, I am genuinely so thankful and I'm so grateful for this opportunity. And I'd just like to pull a book from my German and just say Auf Wiedersehen.
Oh,
So yeah,
really? Yeah.
yeah,
And all the best. I wish you all the best in your career. Yeah. And if you want to kind of shoot me a quick message where you stand, what you want to do or whatever, I would be just interested and see how it goes for you. And but all the best for your career. And it was a pleasure meeting you and then talking to you. Yeah.
yeah. Thank you so much. I don't want to take more of your time. Thank you so much.
Okay. Hey, see you. Yeah. Bye.
Yeah, bye.